Dr. Diaz, you can speak to the preserving fertility in men. And talk to us a little about this, because we often hear about women, but not men. So there are things that men need to look out for as well, correct?
Correct. And this is the same idea here is sperm cryopreservation. Again, with men, it's a little bit easier than the process. For women, preservation requires a more invasive procedure. And the whole idea, again, depending on what the treatment is, if it's going to be multimodality or radiation, the idea of gonadal shielding, like we talked about previously with women. So men have it a little bit easier as far as less invasive, but it's the same topic. You now have to discuss with this new cancer diagnosis about future fertility, fertility preservations, and the costs also associated with this.
And it's good to have options. Are these fertility preservation procedures available everywhere, or are they only at certain cancer centers?
Well, so essentially, fertility preservation is discussed and presented should be presented at the time of diagnosis and discussed further with the specialist after their initial visit with that oncologist, right after the cancer plan is created. If a patient is interested in pursuing any fertility-sparing measures, we refer to a reproductive endocrinologist. Sometimes they're within the Cancer Institute, sometimes they're within the community, but the reproductive endocrinology partners that we work with are typically the ones that are responsible and can create the plan to preserve fertility for that patient. So as Dr. Diaz said, for men, it's much more simple, right? They provide their sample of sperm. It is frozen indefinitely until that man is ready to have a family. And same for women. The kind of harder part for women is that the procedure takes at least 10 days for the most part for women. So interrupting cancer treatment may be a factor when you consider when you initiate cancer treatment for a woman.